Hi everyone, welcome to my presentation on decision-making on diabetes self-management education and support among individuals newly diagnosed with type 2 diabetes. My name is Michelle Bokaye and I'm a third-year PhD nursing student. So type 2 diabetes is a chronic condition which requires active involvement of the person with the condition because the day-to-day management of the condition rests on the individual. As a result of this, the American Diabetes Association recommends a specialized form of education known as Diabetes Self-Management Education and Support, DSMES, for all individuals newly diagnosed with type 2 diabetes. And the goal of DSMES is to equip individuals with the knowledge and skill needed to perform all the self-care activities. Despite numerous studies that have shown the effectiveness of DSMES and the recommendation for all individuals to participate in DSMES, this service is grossly underutilized among individuals living with type 2 diabetes. And patient-provider communication at diagnosis can influence uptake of DSMES. It is in view of this that this study seeks to explore the experiences and perceptions of individuals newly diagnosed with type 2 diabetes about provider communication at diagnosis and its impact on their decision to utilize DSMES. To address the goal of this study, a phenomenological research design was used. Participants were purposefully sampled from research match, and the inclusion criteria were individuals newly diagnosed with type 2 diabetes, were 18 years or older, and have also participated in DSMES after diagnosis. For data collection, semi-structured individual interviews were employed, and all the interviews were conducted via Zoom and were audio recorded. The audio recordings were transcribed and were coded using MassQDA, and an inductive thematic approach were used to identify themes in the data. So for our results, 18 participants were interviewed in all, and most of the participants were females and Caucasians. After data analysis, 3 themes emerged. The first being emotional reactions, thoughts, and concerns at diagnosis. Under this theme, sub-themes were emotional reaction to diagnosis, and treatment concerns. Participants indicated that they experienced a lot of emotional reactions to the diagnosis, and the commonest was denial. When it came to their concerns at diagnosis, they were more concerned about dietary modification, medication options, and treatment goals. The second theme was attitude of providers and communication at diagnosis. Some of the participants indicated that there was some sort of partnership with their provider in terms of the way forward with their treatment, but majority indicated that their providers were not concerned about the diagnosis, and there were also untailored information provided to them. Other participants also indicated the need for a navigation support after diagnosis, as they were a little bit confused about what to do next after knowing that they had type 2 diabetes. The last theme has got to do with decision-making and influences on DSMES uptake. The participants mentioned that when they had to decide whether to participate in DSMES, it was mainly based on what they learned about DSMES at diagnosis and the role of the provider referral. For provider referral, the sub-themes were strong referral and weak referral. Strong referral meaning the provider talked about DSMES and also endorsed it, but weak referral, the provider only referred the participants but didn't emphasize the importance of DSMES at diagnosis. So based on these findings, we conclude by saying that healthcare providers should attend to the concerns of individuals in an empathic manner and also emphasize the importance of DSMES to improve uptake of DSMES among those newly diagnosed with type 2 diabetes. Thank you.